10 signs. You may have depression. If you're having frequent bouts of sadness and negative thoughts, you might be experiencing depression. Left untreated, depression can lead to serious health issues such as obesity, heart disease, and diabetes, even early death. In this video, we discuss the symptoms of depression and how to seek treatment if you think you might have depression. 1. Feeling sad for more than 2 weeks. If you feel down for more than 2 weeks, it's likely you have depression. It's a common misconception that depression is linked with sadness, but in reality it can manifest as feelings of anger, irritability, or frustration. Many people suffering from depression may not even know they have it, and many don't seek help because they mistakenly think it means there is something wrong with them. Depression should never be ignored. If you think you may be suffering from symptoms of depression, talk to your doctor about getting a proper diagnosis. The sooner you seek help, the easier it will be to manage your symptoms so that life doesn't feel like such a struggle anymore. 2. Feeling like you want to die. Depression is a serious health issue, but it's one that can be addressed by treatment. If you feel like you want to die or are having thoughts of suicide, seek help immediately. Do not try to wait out your depression. Visit your doctor as soon as possible so he or she can make sure you get started on a treatment plan as soon as possible. And if your depression hasn't lifted after 8 weeks of treatment, go back for another checkup. Most doctors recommend seeing them at least twice per year once you've been diagnosed with depression. The earlier you catch it, the easier it will be to treat successfully and quickly. 3. Having no interest in hobbies or things you used to enjoy. Losing interest in hobbies or things you used to enjoy is a major red flag that could be an indication of depression. While it's normal for some people to feel less like doing activities they once enjoyed after a stressful event, having no interest in things you used to love can be a sign that something deeper is wrong. Some even experience physical fatigue, which means they have little energy left over at the end of each day, making it harder than usual to motivate yourself. If you're experiencing these symptoms, talk with your doctor about how depression affects your life and how treatment can help you get back on track. 4. Feeling tired all the time. Feeling tired all of the time is a common sign of depression. Sleep deprivation can result from depressed mood, poor quality sleep, or both. If you are feeling exhausted most of the time, or simply not able to do things you once could, chances are that your depression is taking a toll on your body's ability to rejuvenate itself overnight. Fatigue isn't always associated with depression, but if you feel tired all day long for 2 weeks or more, and your sleeping habits haven't changed, see your doctor. Depression isn't easy to live with, but help is available. 5. Sleeping too much or too little. If you're not sleeping enough or are oversleeping, it can be a sign of depression. Getting enough sleep is important for good mental health, so if you're having trouble getting regular rest, seek help. It could be related to depression or something else entirely. You'll never know until you talk to your doctor. And if you're sleeping too much but don't want help, there's a fine line between being lazy and being depressed. It might be time for some professional guidance on how to stop oversleeping once and for all. 6. Constant feelings of worthlessness. Feeling worthless is a classic symptom of depression. Constant feelings of worthlessness can manifest in a variety of ways, but they all add up to one thing: feeling like you're not good enough. It's important that you understand that feelings of worthlessness are common among people who suffer from depression, and it doesn't mean there's anything wrong with you. 7. Anxiety when doing basic tasks. People with depression have a hard time getting out of bed or even getting dressed in the morning. It's not that they don't want to do these things, but they just can't bring themselves to do them. If you're experiencing difficulty doing basic tasks like taking a shower or brushing your teeth, it may be due to depression. And if you are suffering from depression and experiencing panic attacks, it is crucial that you get help right away, as anxiety attacks can worsen depression over time. Talk with your doctor about what treatment options are available for you. There is no shame in asking for help, especially when dealing with a disorder as serious as depression. 8. Trouble thinking, focusing, or making decisions. If you're having trouble thinking, focusing, or making decisions, and it's not because of a specific situation in your life, it may be a sign of depression. But there are some exceptions. Difficulty concentrating may be caused by medical conditions like anemia or thyroid problems. If that's not it, try to identify what is causing these symptoms. If they persist despite what is going on in your life, you may have depression. 9. Recurring negative thoughts. Sometimes called negative cognitions, these are thoughts that run through your head regularly and often have a negative spin on them. For example, you may continually berate yourself for your job performance or beat yourself up for not being good enough in some way. And while these kinds of thoughts can certainly be detrimental in a number of ways, it's important to remember that they're just thoughts, they aren't necessarily true. Recognizing that they exist is one thing, but working to change how you react to them will help improve depression symptoms immensely. Try swapping out recurring negative thoughts with more realistic ones. When you catch yourself thinking something negative, challenge it by asking, "Is that really true?" If not, let it go. 10. If you think you might have depression, seek help. Before you consider self-medicating with antidepressants, get help from a professional. It is crucial that you consult your doctor about any changes in your behavior so he or she can perform an appropriate examination and determine what treatment will work best for you. While depression is a serious condition, there are many effective treatments available. And don't be afraid to ask for what you need. Often people who suffer from depression feel ashamed of their condition because they think it makes them seem weak, but depression is nothing to be ashamed of. It's just something that requires medical attention. Depression affects millions of people each year, but by seeking help we can take away its power over us. Thanks for watching.